Okay, ladies and gentlemen, my name is Lee Miles. I'm the Professor of Crisis and Disaster Management at Bournemouth University Disaster Management Centre, and I'm also the Deputy Dean of Bournemouth University Business School. And welcome to session 7A, which has the title of Reflecting on Critical Points of Failure in Disaster Management, with a focus on early warning, and particularly in lesser developed countries in Africa being a focus. And we have really an interesting panel, and the idea really of the session is to, if you like, reconcile misalignments between what we often think about as having sophisticated planning structures, and the ideas of adopting sophisticated early warning systems, and the realities of disaster management on the ground in many of the lesser developed countries, and in particular in Africa, with a particular focus here on Sierra Leone. So I'm going to start really by introducing the respective people and the format that we're going to take. Firstly, I'm going to speak about a project for about 15 to 20 minutes, where we've been working in Sierra Leone since before Ebola, actually, and been working throughout Ebola, after Ebola, landslides, and most of that. And I'm delighted to have Mr. Martin Travers with us. Mr. Martin Travers is a practitioner and actually was the advisor to the Mayor of Freetown on disaster management questions and other aspects of sanitation. And the idea of that second part is to give some reflection from a practitioner perspective in relation to Sierra Leone. And then finally, we will move online, and we have Joy Isatu Cruz-Sese, a Commonwealth scholar from Bournemouth University, and also from the Public Health Emergency Management Centre and the Ministry of Health and Sanitation in Sierra Leone, who's joining us direct live. And she'll give us some reflections also about those kind of things from the relationship between actually undertaking the research as part of the in the EVALDIS project, but also alongside that from the wider health aspects. Because in practice, in many aspects of Africa, we're faced with simultaneous and shared risks, as we well know, of simultaneous events, and therefore the idea of the early warning system operating at different phases and different times being quite important to the way we think about this. So that's where we really are. So thank you for joining us. And then we'll move out to Q&A and also to some questions online, and then a little bit of reflection at the end, and we'll see how it goes. I'm going to offer the floor really as we do the presentations. If you have any striking interactions that you want to make, I'm very happy to take those as we move through, but we will have a formal reflection question answer at the end of that. So thank you for that. So welcome. I hope you enjoy the session, and your comments and critical evaluation is welcome. So thank you for that. So just to start really with the first, if you like, presentation, and I'm only doing this very, very quickly in a sense. This really is based upon work that's been going on in Sierra Leone for 10 years, and in practice extensively since 2018, and therefore covered throughout the COVID-19 scenario. It covered just after the major landslide that took place there, and also the continuation of a number of major events, including the Susan's Bay fire, where some 4,000 households lost their homes, and also in practice a major road traffic national emergency that took place at Wellington in November 2021. So I'm just going to start very, very quickly, and I'm not going to turn this into a lecture, so let's be clear about this. But first, really, so thank you for that. But really, why focus on Sierra Leone as a kind of model to start us off? We could have picked many different countries, but it's just, of course, Sierra Leone has a reputation in the disaster management field for a number of reasons. Of course, one, of course, is it's placed in West Africa, which is high levels of vulnerability to aspects like communicable diseases and vector diseases. That's part of that, and there's a heavy disease burden. But also Sierra Leone, of course, is also with a population of about 8.4 million, relatively small country. But the important thing from this context, it's also a relatively poor one. And most indicators, of course, indicate that Sierra Leone is ranked in the bottom quartile in terms of human development indexes, according to the United Nations Development Programme, in terms of life expectancy, levels of education, and GDP per capita. In other words, we're faced with very limited resource abundancy in the country, and is a reflection of parts of West Africa in a more deep-seated way. But the other aspect, of course, is that Sierra Leone is often known because of its kind of media profile. from civil war through to looking at issues to do with landslides, the Ebola episode, and from that COVID. And the National Disaster Management Agency, the NDMA, in its 2022 report, and the NDMA, its first ever National Disaster Management Agency, was only established at the back end of 2021, if I remember rightly. In its first report, he outlined they had 291 disasters or major incidents between January 21 and January 22, which of course is close up to almost one a day, which means we've effectively got a high propensity for demand on very, very scarce resources in the way that we look at this. So what we're arguing here, or what we're reflecting on here in terms of our early warning discussions, is there a misalignment in many ways between what is often a solution to use high-tech solutions or wider solutions and the reality and applicability to some parts of the world where these solutions are, let's say, expensive, hard to maintain, and have challenges in many instances. So what I really want to put this in context is really just to introduce you to, and I'm not going to turn this into an AFRICAB or EVALDIS roadshow, but I just want to illustrate that the focus of these projects are on identifying what are effectively the extreme criticality. Those elements of what many people might call single points of failure or critical points of failure, which actually lead to partial breakdowns in all or part of the disaster management system. And also fundamentally alongside that, with limited resources, you can identify that these are small managerial often aspects where resources are placed in the resolvable areas, you can actually lead to big enhancements. So negatively, small sectoral technical issues which have wider, bigger implications, but at the same time also have those aspects. And this work really has revolved around the two major projects, one called the AFRICAB project, which was funded by GCRF, of course, and was working with partners, firstly the the Office of National Security, and then the National Disaster Management Agency, and also Freetown City Council. And the important thing from that perspective is that we were working both with the national and the local, but also with both sides of the political spectrum in one simultaneous project throughout the project. And at one point, the president and the vice president were involved in parts of the project, and at the local level, the candidacy for the vice presidency was actually probably also being sought by another member of persons in the project. And anybody who knows anything about Africa or in many parts of the world, issues of politics, this is a highly problematic issue about identification and being able to work in these scenarios. This was followed by what was called the EVALDIS project, which looked at basically local disaster management in Sierra Leone, which was funded by Research England's Participatory Research Programme and the Talent and Stabilisation Fund, and again working with the National Disaster Management in Freetown, and involved an extensive array of doctoral researchers, associate lecturers, research assistants and Commonwealth scholars as part of that ongoing work. Now, I'm not going to go into great detail, but basically what the AFRICAB project in many ways has been quite successful, one would say. It was awarded by the association, the AACSB, which is the largest association of business schools run by Harvard and Stanford, as being one of the top 25 projects in terms of innovation in this area this year. So it's something that illustrates how business schools can also play a role within this, but that's a discussion for another day. But the outcome really of the first project is it led to a government report launched in 2021 under the auspices of the National Disaster Management Agency. It was a government endorsed report, and that led to an implementation matrix being adopted by most of the government departments across the ministries, looking at how these single points of failure which had been identified could actually be built in and dealt with. That was formulated in December 2021, and later on in a presentation by the Chief Minister, the Prime Minister of Sierra Leone, that was formally adopted as his proposal and moved forward to a World Bank proposal later on. But the extensive impact of this, of the ability to use single points of failure as a practical tool, as a diagnostic tool, which policymakers can use in these kind of countries, is being fundamentally illustrated by the wideness of the achieved impacts of that particular project. So you can see here in practice, it led to, and I'll talk about this, when a major incident took place in Sierra Leone what was called the Wellington fuel tanker incident, where a major tanker caught fire and exploded and led to a presidential report. 10 of the 13 recommendations from the AFRICAB review project actually found its way into the final presidential report. It also influenced the creation of the first new standard operating procedure for release and response for the National Disaster Management Agency, a new service charter for the agency, and 2 policy papers, one of which was about early warning, which was proposed for the Sierra Leone government to COP27 in late 2022. But the other factor, probably the factor that I'm probably most proud of, is also the fact that it also has led to involvement with local communities. The creation of a facilitators guide, which is where the award was take place, and even reached a level of a new standard operating procedure for the dump sites. 2 major dump sites, which Martin may talk about, Kington and Kissy, which have major vulnerabilities in the city, and led to staff being trained in single points of failure diagnostics around that sites as well. And the Freetown's first climate action plan of 2022 to 2030 used single points of failure diagnostics as part of its evidence base. Not all of its evidence base, but part of its evidence base, because in many of these countries, practical evidence that can be used across the political spectrum and across the levels of national and local is part of the challenge of being able to deliver that. In terms of methodology, it also meant that we joined the pillar system. So myself and Martin at various times were actually part of the National Disaster Management Agency's emergency response systems. So we were stood up with police, the fire service, and many of the ministries to deal at the national level, and also at the district level within Freetown City Council as there. So I don't really want to go into great details, but you can see the illustration of the impact. But what I also want to, why is this important? Well, in many ways, for me, in working in these fields, one of the real challenges, how do we actually make early warning systems work with local communities on the ground, where many of the factors about how indigenous knowledge is built into those systems. We have a lot of work in the field talking about how we recognise participatory early warning systems and how we're building indigenous knowledge into our understanding of that. And the EVALDIS project, which was the second project between 2022, was involved in actually doing a number of things. Firstly, on the basis of the AFRICAB project, it led for a call from the government to set up a new NDMA provincial and district offices across the country. And the idea was therefore to provide a single points of failure analysis for them, involving them as partners, so that they could identify how they could set up and how they could move this forward. And as Martin will talk about in a little bit more detail, at the Freetown element, it led to a comprehensive focal groups covering all 8 blocks, all 48 districts, and involving councillors, health officials, members of the NDMA, and the local citizens and volunteers across the entire city of 1.2 million people. So a comprehensive data set in which they identified at the ward level the single points of failure, so for their own regions, and where that was shared by districts alongside them. So we have the ability to provide a diagnostic platform which goes from the very small level of the block in Freetown all the way up to the national level, which is an interesting point as a data set. How was the project built, of course, and I'm not going to go into great detail, but what do we mean by single points of failure? And I'm going to use very simple terms here. I know we've got a large academic audience, but this project was fundamentally about reaching out to be able to work in those community settings. And single points of failure, of course, are in many ways, those could be places, situations, locations. They can be an entity in terms of organisational teams and procedures, and they can be other aspects where the major emissions or major issues lead to challenges. But we also have to think about them conversely, which is in very simple terms, that resources are precious. It may not be, the failure may not be due to a lack of, but simply the overwhelming of existing resources. Precious resources not being able to be used effectively is a single point of failure, as much as weaknesses in those provisions are. So from that perspective here, and you can see here is an example from the Wellington fuel tanker incident, where the single point of failure around the cordoning, for example, of the incident straight afterwards, with one of the local ewes being on top of the tankers only a few hours after they had made a major explosion from that. Now, I'm not going to go into what are the single points of failure, but the technical areas, but fundamentally, the important thing is many of us know in the room what they can be in the disaster management field. And if you access the slide, but they're effectively arranged across numerous areas. And one of the challenges with this kind of work is that often the policymakers know what the single points of failure are. They don't need it necessarily to be tested in a disaster. They're aware of those issues in many instances. What they often lack is a consensus of evidence base about how to address them, to provide that element. And this causes major problems, if I may say, with international organisations who often tell them what they need rather than what they want. And this provides a way of empowering both the local communities and the Sierra Leone's in negotiations and discussions with other NGO organisations about what they might want in practice. But the two major dynamics, which I will explain, is the projects were really about types of single points of failure. And the important aspect here, focusing on three types, but the main one being the resolvable ones. You have single points of failure where if resources are put in, it may be small, it may be just training, it may be simulation work, it may be a simple budgets, it can be equipment, it can be just resources of that kind. If you put those resources in, the single point of failure is resolved. It's fixable, it goes away. It may not go away for a long period, but it goes away, and therefore it's resolvable. You have residual ones, which are fundamentally where you can do the same, but fundamentally that only leads to partial relief. You still have a propensity for failure, and therefore that's effectively risk reduction of that propensity to take place. And finally, you have those resistant ones, where effectively you have to ring fence or recognise that no matter what happens, the disaster management system will fall over, and the early warning system will fall over in these countries if faced with these particular types of single points of failure. So in the EVALDIS project, we were using participatory research techniques, in particularly integrated knowledge translation, and that meant that we were highly involved in focus groups, steering, which the research was designed through steering groups at both the national and at the local level, and involved a traditional kit methodology about shaping this research and scope, the implementation and context, and the local interpretations. In other words, tracking the narrative around the single points of failure throughout the entire propensity of the project to be able to understand that may be. Now, this led in March 2023, this year, to the EVALDIS report, the second report, which involved some 259 participants, identified 12 cross-cutting single points of failure area, and identifies 52 specific proposals, which the national and local governments, and 62 immediate action points where small elements could lead to major enhancements. And we often talk about reports. We have thousands of reports, but the fundamental point is that this involved high participatory level. It was launched by the government, but also involved all of the participation of the local communities, and therefore in Freetown. And in that instance, therefore, provided a substantial amount of cross-fertilisation across the political spectrum. What were the methods that were used? Well, classic participatory techniques, one-to-one interviews across the portfolio at the national and the national level, involving most of the ministries, involving the national stakeholders, NGOs, and many other actors, representations from Freetown City Council, and then focus groups in particular, as we mentioned before, in 8 of the blocks and all of the particular area, all 48 districts, really at the community level. And then really the teasing out of that in relation to emergency management. So as events were taking place, we were doing peer observation and actually some participatory work. I would say it's very difficult not to try to help when you're in that field scenario, to also provide reality as to whether these single points of failure bore out. We were also involved in doing some simulation work in which we were looking for the workarounds, because as we well know, many African countries have fantastic plans. They're often written by many NGOs, they're often written by many hybrid organisations. The reality, however, is that they're not implemented. And those are the aspects that we think about those there. In particular, alongside that, it also involves stakeholder interviews, focus groups, but also with the new NDMA national provincial officers, setting us as a focus group to identify how that would translate across the districts at the wider level. So incorporating the community, the district, the provincial in this particular project, and being confirmed within peer observation throughout. So what are the findings? Well, the report is available. It's a free report. If you look at EVALDIS on the on the internet and look on the EVALDIS website, you'll be able to get a copy of that report. So I'm not going to go into the great detail. Apart from, not surprisingly, if you're involved in early warning systems or disaster management, most of the key areas that the usual suspects are there. But in practice, I think the important aspect for us is that there were 6 findings that were shared across all areas of the district, provincial and the community. And there you can see them on that slide there as being there. And I'll make these slides available to whoever wants them in relation to that. And they're in the report. But across the 12, really, we see major issues in relation to, particularly at the provincial and district level, which is the development of the NDA structure, data management, single points of failure about the availability, consistency of approaches of data, particularly on lists of affected persons. One of the real challenges, as we all know, in dealing with incidents and response and actually early warning, is that lists of affected persons are very difficult to manage, because rather there tends to be an acceleration of people who want to be on that list because resources are attached. And then the major issues with risk communication, with critical infrastructure, logistics and human resources. But what does that mean for us in relation to early warning systems? So getting down to that, and I'm just going to spend 2 minutes, if I may, just outlining that as the conference is really looking at effective early warning systems for all. And I think the focus should be on the all, which is why this conference is so useful rather than on the some. I think the important thing to recognise is that quite obviously when we looked at the data coming through, there was a higher priority on early warning systems, surprising the data at the provincial and district level amongst the policymakers as to for the need for that in the data. I think Martin may say something slightly different, but in the data we have a strong propensity or strong loyalty or belief that early warning systems and technological solutions will provide major enhancements, and they will, of course. I don't want to come across that I don't think they are useful. They are fantastically useful. But there was ironically, much less emphasis placed in the data from the local communities. So where we expected the local communities in many ways, and when they were identified what was their single points of failure and what were their list of priorities, often early warning systems weren't in the top 5. They were often somewhere around the top 10. In relation to that. And that partly may be that there's a less conviction, there's more emphasis on they need tools, and they need very simple stuff to be able to deal with that. And it's a volunteer force that is fundamentally in your local community that is your disaster management response. So the early warning system action has to be translated into something that volunteers in these countries can deliver quite substantially in the way we move forward. And for them, they were perceived as being more expensive and distant, and perhaps not owned by communities. And it's the ownership maybe that has some of those elements. So from the data we have in this report, for what we have with the interpretation, there clearly needs to be more work to be done. But the striking factor when you look at the profiles, and I will not go through them, we haven't got time, but they're in the report, is that in the report we outline the very different types of spot challenges, and particular ones identified in the stakeholder interviews, the focus groups, and by the national provincial groups. You can see striking commonalities, which gives us consensus, but you also see variation around those particular elements. And there is a particular aspect in relation to early warning systems themselves and the coordination and ownership of those. One of the challenges is that many of the communities maybe actually suffer from a kind of early warning system exhaustion, because there are many early warning system projects in which they are often offered to be invited to join. In Freetown, I remember being at one meeting where 3 simultaneous projects in early warning were actually being implemented without each other knowing about each other. And that, from a community perspective, that illustrates some of the challenge that we have in relation to that field. So why is this important? Well, the endorsed report itself has now led, it was picked up by the 6 o'clock news. We actually beat the UK Foreign Minister to the top of the 6 o'clock news, which illustrates to the extent to which this work has impact. And of the 13 major national newspapers across Sierra Leone, across all of the areas, it featured in 10 of them in relation to the work that's been done. So the kind of work that this conference is talking about is absolutely critical to the future of countries like Sierra Leone. I can't stress how important these kind of events are, but the reality in the plea is that we have to translate that into something that communities can use, and more importantly, can provide a narrative across the country and political spectrums if early warning systems are to be universally adopted in countries like Sierra Leone. And I'll end with one final slide. How much impact has this single point failure narratives had in Sierra Leone? Well, I was contacted only a few weeks ago by the head of the NDMA, where they were meeting with their National Society of Geoscientists about the uses of single points of failure, where they asked me not to be involved and they were going to run it separately. There illustrates when true capacity building may be starting to be working for the future and beyond. How long it lasts, we'll wait and see, probably until the next project comes. But fundamentally, there's an illustration about how we need to transmit the idea of single points of failure to make the critical elements which are of use in countries of this kind. I'll stop there and I'll hand over to Martin. If there are any burning questions, I can take one, or if there's any issues anybody wants to raise, otherwise we'll hand over to Martin. Thank you. So Martin will talk, and Martin is a practitioner, and I'll let him introduce himself in relation to where we are.
Yeah, good morning, everybody. I'm Martin Travers. As the professor has said, I'm an independent consultant in disaster risk management and an associate of Bournemouth. I've worked for much of the last 8 years in West Africa, but also in other parts of the world, such as the Pacific and the Caribbean. My interest in West Africa has been largely around Sierra Leone, but also countries like Liberia, Guinea, and most recently Nigeria. My background is really two-pronged, if you like. I have a military background, which saw me in Sierra Leone for 3 years as part of the British effort to build capacity in the security sector following the Civil War, which ended in 2002. And then in that period, part of my work shifted very strongly in emphasis to disaster risk management following a landslide that happened in 2017. That killed 1,100 people, required a big international response, and unsurprisingly, the military had a big part to play in that. I then left the military and I became the advisor, the senior strategic advisor to the inspirational Yvonne Akisoya. If you haven't heard of her, please look her up. She is a force of nature, I would say, in Sierra Leone and West African politics. I had a number of roles in support of her, but the ones I'm most proud of are around climate action and disaster risk management. It was that relationship that brought me into contact with the work that the professor was doing in disaster risk management. At this stage, what I'd like to highlight very quickly, maybe something we can come back to later, is all this experience highlighted to me the relationship between research and practice, academic research and practice, and how they can be linked together in real time to deliver effect. So the shocks that I experienced in Sierra Leone specifically are here. I arrived in 2016, just at the end of the Ebola outbreak, and then I was on the ground and supporting the various other shocks that happened over those few years, starting with the landslide in 2017, that killed, as I said, 1,100 people, the floods in 2019, which destroyed large parts of the city, the COVID-19 outbreak, which had a serious impact on Sierra Leone, as it did in the rest of the world, and then from there straight into the fires of 2021, in excess of 40 of them in the city, largely resulting from changes in the climate and extreme heat. And then my final experience really was being on the ground for the tanker explosion that the professor has alluded to. So early warning systems was a big part of the work that I was doing both with the mayor and with the National Disaster Management Agency in my dealings with the professor. This is the nirvana that we were trying to get to in terms of early warning systems from a practitioner's perspective. And I won't read through that, you can read it yourself. And you probably know more about what the theory of early warning systems is. But really, for me as a practitioner, the first bullet in the bottom there, provide early warning of impending shocks to governments and communities at risk. That is really the key thing we're trying to achieve out of early warning systems. Progress in Sierra Leone concerning early warning systems was mixed. This slide shows you, the systems that you no doubt know a lot about in terms of both data collection and action. In terms of data collection, we're looking at climate information and GIS systems. The former to provide this sort of live-time reporting, the latter, the GIS work, to use existing technology to work out what places were at risk in terms of simple things like elevation. I would say that in terms of progress in Sierra Leone, those areas, although being addressed, still very much are red. Nowhere near as effective as they need to be in a country like Sierra Leone, but people starting to address it, funding starting to come online. In terms of response, in terms of action, which I'll come on to in a minute, I would say amber. So although technology was lacking, some of the systems, the human terrain were in place in terms of responding to early warning systems and implementing the sort of responses that would save lives and preempt disaster. So I'll come on to this in a bit more detail in a minute. So really for us, it was all about using existing technology while the clever technology was being developed. And there's plenty of it out there. And I think for those who are concerned with working in countries like Sierra Leone, who are at the bottom end of the financial spectrum, if you like, the development spectrum, there is existing technology out there. Basic weather reporting can be accessed online. And if you can match the reporting to the communities that are on risk, then you can have some impact. So in the council, we were using this system. We're getting the daily and the weekly reports. We're identifying when high tide was. We're identifying where winds were strong. And we're identifying when heavy rain was anticipated. That's a very manual process. But you can see that red box shows you that at that period, on that day, Friday the 10th, at 10:15, communities in the coastal areas need to be aware there's going to be high winds, high rain, and high tide. You might want to think about moving. Likewise, Sunday the 12th, same thing. High tide, close to midnight, high winds, lots of rain. And then finally, on the 15th of that month, very high winds, high tide, risk of thunderstorms and rain. So it's a very manual process. So really the message for us in the council in Freetown is use what you've got while the clever stuff is being developed. So focusing people on early warning can have serious and real impact. In terms of the concurrent capacity building early warning systems, our view in the council was that it wasn't just a top-down process. Everyone needed to be involved in the discussion about early warning systems. So at the top end, the areas that the professor was trying to influence, and the area that the mayor and I were trying to influence in the bottom up, at the national level, there are various organisations, not just around meteorological issues, but also land, development, science and tech, all the first responders, and the military who had the equipment. They need to be in that discussion. Institutions, universities and the schools, we're trying very hard to get universities to sponsor projects in climate action and early warning systems. At the subnational level, in West Africa, there is a problem with getting national governments to trust subnational governments sufficiently to delegate authority for things like developing early warning systems and other assets to their effects. Communities, some of the less obvious ones, faith leaders, tribal leaders, ward leaders, all these individuals, because these are the people who are going to be the recipients of information and the people who will be acting upon it. And then creating networks that include all those four groupings to actually address and operationalize the early warning systems. So that's what we're trying to do in terms of comprehensive EWS capacity building. We also looked at what communities need to look like to make best use of early warning systems. And these were just some of the criteria that we felt needed to be applied at a community level to ensure they were well prepared to actually respond to early warning systems and to implement the information that is passed within them. So, for example, if you have a well-governed organisation, one that is able to assess and monitor its own risks, is able to learn from the past, then that community will be better placed to act on EWS than those that aren't. Again, if you have communities that have got employment and income, there are things they can do locally to improve their own EWS without the intervention of anyone above them. So it's not just the top-down process, it's bottom-down, and empower communities that have got things like infrastructure and services, can manage their own assets, and are connected to external actors. They are the communities that can really make use of EWS. And that can buy you the space and the time to develop the high-tech stuff at a higher level concurrently. So communities are really important. The sorts of things that we're encouraging, that the mayor was encouraging Freetown, was getting the communities to do their own stakeholder mapping, so they knew who they should be talking to around the early warning systems. They understood who is going to provide them the information and who they should be talking to implement the responses. They're being encouraged to do their own all hazards identification, which I'll come on to in a minute. And the facilitators guide that we worked in collaboration with Bournemouth with actually gave them the information that they needed to do that at a community level. And then encouraging communities to develop their own action plans. What do we do as community action if we get the storm warning from the city council for midnight tomorrow night? What are we going to do? What is the action plan? Is it goes to mosque, goes to school? These are sorts of things that we need communities to work on so that they can make the best use of EWS. In terms of the human terrain, these working groups I spoke about, these are the people that we felt needed to be involved. And they were involved in all those shocks that I showed you at the start of the presentation. So at the Wellington tanker explosion, all these people were sat in that room. That picture was taken at the site at Wellington to discuss the response to the Wellington fire incident. And the same really applies for EWS. If we're talking about EWS, development of EWS, then these are people that need to be involved. Some of them are very obvious. The less obvious ones, like the utility companies, have a really big part to play in countries like Sierra Leone and regions like West Africa. Because many of the accidents and incidents that occur in these countries result from poor infrastructure like electricity and floods. A quick case study. This is Freetown, the capital of Sierra Leone. Those highlighted numbers are the wards. You can see they're in different colours. So each ward is run by an elected ward councillor. There are 48 of them, and they're grouped into blocks. You can see the blocks. There are 8 blocks, each are grouped in different colours. Each has got 6 wards in them. So that was a very good structure that we could use to overlay EWS. Forgive this slightly complicated slide, but at the top you can see the 8 blocks. Blocks 1, 2, 3, 4, 5, 6, 7, and 8. Just going back to the map, you can see that those blocks are represented here by the different coloured groupings of numbers. Each block had a councillor in charge of it, and the CDMC was a Community Disaster Management Committee volunteer. So you paired an elected councillor with a volunteer. And those 2 individuals became responsible for their block, which, as you can see, if you look at block 1, the row below, Ward 399 to 404, that block councillor and his volunteer are responsible for those 6 wards. And then each ward, if you look at Ward 399, you can see that is further broken down into 4 communities. So that provides you a structure through which your EWS systems can operate, either manually or in the future through high tech. And this is the framework that the Mayor of Freetown is using to build the EWS structure in Freetown. And it's also the framework that is going to be copied and duplicated across other cities in Sierra Leone, and in other rural areas. Now, regarding the community-led hazard identification, again, this is a very manual process, but it really supported EWS in my time there. And we use this when we're doing the manual weather reporting. So, for example, you can see here Ward 399. Their hazard identification system demonstrated that the 4 things they were most worried about in their area were flash floods, landslides, fires, and storms. The biggest one was fires, because they're a really highly populated slum area, just away from the coast, inland, loads of electrical infrastructure, lots of cooking inside houses, historically lots of fires every year. This is the Susan's Bay ward that the professor spoke about. They were less concerned about flash floods, because they were slightly away from the coast. And they were worried about storms, as most Bretonians always are. And that ward level risk assessment allowed the mayor to know who to prioritise the early warning systems at. So in the council, in our little team, when the weather reports came in, we had a report of a flash flood coming in the next day. We look at our chart, and we had this on the mayor's office wall, loads of colours, 48 wards. We look at wards 401 and 402, flash floods. We ring up the councillors, say, councillor, flash flood anticipated tomorrow night at midnight, high tide, lots of rain, flash flood anticipated. Please implement your community action plan. So this is all very manual, but it's an early warning system, and it works because it is overlaid upon a structure that everyone understands. And the important thing is it can be scaled up with technology. And that also provided this, who needed to be prioritised for EWS, allowed us to identify safe spaces. So those 2 wards, 401 and 402, we knew, or the mayor knew, there was a school and a mosque in each of those wards where everyone could shelter in on high ground in the event of a flood. We agreed warehousing and emergency supply locations in the city with the National Disaster Management Agency, so that we knew that there was going to be emergency supplies, things like water, blankets, shelter, in the event of fires and floods. And we're able to inform the donors and the NGOs, where the funding priorities need to be. Coming to the end now. So in terms of the impact of having prepared communities, this is probably the best photograph I took, I think, when I was in Freetown. This is in one of the coastal wards. On the left, you can see a waterway completely blocked 1 year by trash and various other items that come down the hillside. The community took action. They managed to get a construction company in. They spoke to the other communities upstream to stop them throwing stuff into the waterways. And this is the picture taken the following year at the same time. So that shows you what a prepared community can do with very little intervention. Challenges, I'll leave this up, but in West Africa, these are the challenges that practitioners face all the time. Lack of decentralisation from national to local government, corruption, politics. So in my experience, my mayor was being blocked in all sorts of ways because the national government didn't want to succeed. Huge poverty gap, issues around education and training, resistance to change. All that leads to donor fatigue from some of the big NGOs, which means you have to have local solutions. Overpopulation as a result of rural to urban migration, and then climate and environmental risk. That's it from me. We're short time and we need time for Joy to come online. So I think any questions will lead to the end, probably.
Yeah, that's. And there's the final part now. We hopefully, if Joy is with us. Joy. Sorry.
Yeah, I'm here.
Hi, Joy.
Hi.
I'd just like to introduce to you Joy Isatu Joy Karusese. She has multiple roles actually in why she's so valuable and useful to give insight into early warning systems. I had the great privilege of teaching her on the Masters in Disaster Management as a Commonwealth Scholar at Bournemouth, where she come previous to that from the Department of Health and Sanitation and had worked strongly in that field. But actually, the important thing about Joy, is that she was not only a practitioner, but then she went back into the field and actually ran most of the EVALDIS as the EVALDIS country facilitator and most of the focus groups as part of the data collection, and therefore provided some major insight in that. And now goes back into the Health Emergency Management Centre, dealing with crisis, working with the WHO. So she has a full array of compliments. So I'm going to really ask Joy. So welcome, Joy. Thanks for joining us. I do appreciate it. You're in the States at the moment anyway, as opposed to Sierra Leone. So
Thank you for having me.
the one good thing is we might have a power cut, so we'll be okay. So let's hope we don't. So from that perspective, let's move on. I asked Joy really to reflect on 2 or 3 things, but I'll let her free range really. I gave her a couple of things that I wanted for her to reflect on. Firstly was in relation to early warning systems and the collection of the data in the communities themselves. What kind of messages were you getting from the actual communities about the value of early warning systems in the cross Freetown? That's the first thing you'd like to reflect on. The second, because of your health background and your health expertise, one of the challenges in many parts of these countries and in many parts of the world now is we're actually dealing with simultaneous hazards and challenges. And of course, throughout the period we were doing this data, particularly in AFRICAB, was also the COVID period as well. We're also facing regular events. And what are the challenges for the kind of early warnings implementation that we might need? And thirdly is about the health, any aspects that have there. So really about your reflections on the communities, your reflections on the shared challenge from the health perspective, and finally, what you think are the early warning system requirements from the health perspective in Sierra Leone. Over to you, Joy.
Thank you, Professor Miles. Thanks for having me. So during the EVALDIS project, I actually had the opportunity to interact with the community because we went down to the community because we were using the bottom-top approach, and most of the time we sit down on tables and make policies and we don't even think about those other people that we're making the policies for or how it will impact them, or like hear their own stories and take from their local capacities that they're using, their local resilience, facilities or structures that they have, and then we build on it. And we, through the EVALDIS project, we found that that's quite an approach that really works in disaster management. I mean, using the idea of the single points of failure. So, and in terms of early warning systems, most of the challenges that came from the community is a lack of data. So we have, like Martin mentioned, we have structures in place in terms of early warning systems. We have the meteorological department, and we have the West African Early Warning System Coordination Office, which a lot of community people did not even know about. But weekly data is being sent, but it goes mostly to officials in the NDMA, Ministry of Health, those working in FCCs. And through the FCC, we had the community disaster management officers, which are very much involved in disaster management, helping the community. So those are the voices of FCC in terms of disaster management to the community. But most of the challenges is the community knows the community disaster management committees members, and these are being used by the FCC, the Freetown City Council, and the body that is responsible for disaster management, which is the National Disaster Management Agency, does not really use them often. So we have this segmented project, we have this segmented ideas that are coming up, and it's not coordinated. So that's one thing that the community suffers from. And most of this data is sent through mobile phones and social media platforms and all. And the local community sometimes cannot get hold of it. And some of the challenges that we had, some disaster management committee members did not even have the gadgets that they were supposed to have. Some had mobile phones. But imagine you trying to send an early warning system for a flood, and the city is having torrential pour down of rain, and there is no network facility. I wonder how the community will get that. So it's about them getting the data, and the data that they have from the community reaching up to the persons that are really responsible for taking decisions is quite a problem. That was a challenge that was mentioned during the projects that we did, the focus group discussions and everything that we did. And there's the NDMA watch that the National Disaster Management is doing, and which involves selling early warning signs and systems. But most of the time, the National Disaster Management actually puts their efforts and resources in response rather than preparedness. And we know early warning systems is part of a huge core of preparedness circle in disaster management. So most of the data that they have are kept for their purposes, and it's kept at high level, and it doesn't reach the community at all. And all they do when the disaster happens is go there to respond. That's one problem that they had. And as for the West African Early Warning System Coordination Office, a lot of people did not even know about it. Even the officials, those that were in the district, those that had top positions, did not even know about it. So it's just a lot of organizations, a lot of efforts being in ISOs are not reaching really where they should get at. And at the end of the day, it is a community that we want these messages to get onto, because they have local coping capacities. They have local resilient facilities and structures that they have built. But most of the time, resources are a problem. And then we really don't go to do proper research, thanks to Bournemouth University, to the FCC, to NDMA, that is now going down to the community to do the research, because you can actually build on their local capacities, on their local knowledge that they had. That's why we're doing the knowledge transfer system, and use it to build on it and then take it back to the community. Then it will profit them. Then they can see it as their own, instead of you trying to impose things on them from your policies or from research from other countries, research from other places that you bring in, because these districts are unique and their risk does not cut across. Each district has unique risk. Each ward has unique risk. So you cannot take another ward's risk and bring it to the other. You have to do the research and know what is really their problem. And thanks to the EVALDIS project, which made us which was an eye-opener for us to see many of his challenges. So in terms of the health, because I work for the EOC, the Ministry of Health, to the WHO, we actually prioritize 10 risk. When you think of Sierra Leone, we have 10 prioritized risk. And that was done through the STAR report, the Strategic Risk Assessment Report. It's a tool that was designed by the WHO, World Health Organization, and we use that to prioritize our risk. And the health has actually made a lot of impact in terms of early warning systems. We have the integrated disease surveillance response that cuts across all the districts. Once a data is generated, it comes to the highest level. Everyone can see it. That's the IDSR that we use, and it's widely used in West Africa. And Sierra Leone has gone far to make it an IDSR, electronic IDSR, where someone can input the data at the facility or in the community by the community health workers, the CHWs, and the Minister of Health can see that. So the health has really made a lot of impact. And getting back down to the community, we communicate to surveillance officers, because we do active surveillance in the communities, in bordering areas. And so health data is actually passed on from one level to another easily, because these are systems that were built post-Ebola because of the lessons that we learned through the Ebola. And the sad lessons that we had to learn, by the way. But thank God, and we've moved far now, and to the Emergency Preparedness Office, we're doing so well. But then again, coordination is a challenge. So when we did the strategic risk assessment on behalf of the country, we had representation of all sectors, NDMA, like meteorological department, and we had a university and all. But you find that most of these efforts are being done in ISO, like in segment. And you will see NDMA doing a simulation exercise on fires without the Ministry of Health being in representation. So if we were more coordinated, if we were more, then these efforts would have been, if it would have been seen, and it would have impacted more, because we are all working towards early warning system and how we can make the disaster management and health disasters much more accessible in terms of data and everything. But we keep doing it separately. So the Ministry of Health to do their own, and we have common risk. Like, for example, when you talk about fires now, it is NDMA that is in charge. And that is one of the priority risk. When you talk about floods, it is NDMA that is in charge. But how are we going to make sure that NDMA and Ministry of Health, because we need Ministry of Health doing fires, we need Ministry of Health doing floods, are going to come together, sit down, get a single plan, and then respond, or get a single way of sending this information instead of information going out. So you see that when it comes to fires, it is not Ministry of Health that is in charge of sending early warning systems, and it's NDMA. But I think it should be done together, like in collaboration. And when you talk about like an outbreak, it is Ministry of Health that is supposed to send data of early warning system. Meanwhile, there is NDMA that is responsible for all disasters. But a progress we have made, again, thanks to the telecommunication services that we have in the country, because there are MOUs developed and they are helping with disseminating information, especially in health. Once we start having flood, you'll see early warning system messages, early warning messages going out for cholera preparedness. The Ministry of Health to activate their plans for cholera and all other diseases that we might project during a disaster, in case there's a multiple disaster or so. So I can say the Ministry of Health has made tremendous growth, and in terms of early warning systems, we're not there yet, but we have done so much input. We have done so much progress, thanks to IDSR.
Thank you, Joy. Thank you, Joy. The idea of that was to give you some illustrations of some of the challenges there. But one of the points that comes very strongly when we talk about early warning systems in the Sierra Leone case is you have a difference of heritage or legacy. In the health area, because of the experience of Ebola and now COVID, large amounts of investment in high-tech surveillance and intelligence systems, so that in many ways the health response systems and surveillance systems to deal with communicable diseases, the early warning is one of some of the best, and it is very, very strong. And therefore, there's a highly coordinated and effective network to track cases and all of those elements. At the very same time, other parts of the government are still using Microsoft spreadsheets. And therefore, the coordination between government ministries about early warning communication within the notion of is very asymmetrical. So although we recognise in many of these countries, as we do in many of our instances across this audience of experts, that the notion of shared risk and shared vulnerability and integrated response is critical to the way we think about early warning for all, what we have is, even in the is a segmented early warning system approach. And fundamentally, that leads to problems of coordination, both at the national level and vertically, as Martin was talking about, between the national and the community or subnational level, and also across sectors. And those create fundamental challenges, because fundamentally alongside, it's not just about the kind of investments that we put in place to support this, but also the maintenance of those. Because the other challenge is that many of these systems outside the health area are simply not maintained, and therefore they have limited value or lifespan before they become ineffective. So many of the issues we've discussed and hopefully brought up are many of the common issues that you've felt throughout the conference. But the whole point of this session was really to illustrate some of the practicalities across the theoretical, the research, the practitioner, and of course the reflective approaches as to how it actually operates, and the gap between early warning system planning and actually the reality of the communities on the ground. So I'm going to stop there and thank my fellow speakers for their contributions. And now I'd like to open it out to the floor, if I may, for any contributions, reflections. I think there's a gentleman. Thank you. There's a gentleman right at the... Oh, sir.
Bob Goldhammer with the International Association of Emergency Managers.
Welcome, Bob.
Thank you. I wanted to go back to a comment that you made in one of your slides earlier, and then specifically a question for Joy. You mentioned that in your findings from the early warning system evaluation, that the system was perceived as expensive and distant and not owned by communities and by distant stakeholders. I've been doing emergency management work for 30 years. Prior to that, I was a paramedic for 25 years. And one of the things that we found necessary to help move projects along was identifying the socioeconomic cost of trauma to people that were injured and killed in an event. So Joy, I was wondering, do you have any studied information on what the socioeconomic cost of the loss of life, of a life in Sierra Leone is? And maybe if that spreads out across Africa and even further, so we can try to narrow down a cost of what we're losing by not spending a little money.
Actually, I can't say we have a data of that, no.
Do you have any reflection at all from your just experiences, Joy? Because obviously that data probably doesn't exist. And there's probably a good study there to be done in relation to that.
Exactly. That's the thing. You know, research is actually a problem. So that's a study that can be done there. But I think that's a huge loss for you to lose a life. I mean, yeah, the socioeconomic impact is going to be huge because the dynamics of our community is interrelated. One person can have more than so many people in the household, just depending on one person, and imagine losing that life. There's going to be a lot of impact. That's going to be a lot of loss. I think that's an area of study that we might want to look at. Thanks for bringing our attention.
Thank you, Bob. I'll just hand over to Martin. Martin's got a response for you.
Hello, Bob. I think the response I've got is that in Sierra Leone there was
Just on camera. There you go.
in Sierra Leone there was detailed loss and damage assessments done after every incident. And as Joy said, some people lost everything. And in a very poor country like Sierra Leone, you know, a small fire can destroy an entire household and everyone's possessions with one stroke. So that's the first point, and all that is on record, and certainly in the council in Sierra Leone. But I think the wider point is persuading the people with the purse strings that if you spend a little bit of money now, you can save a lot more later. And certainly for the mayor in Freetown, that was one of our biggest challenges, trying to persuade people that a little bit of investment at a community level in things like early warning systems, things like anti-flood systems, that would prevent a lot more expense later down the line. But that was the sort of political dynamic she faced every day.
I think your point is valid in the sense that if you take Freetown, there's 70 different informal settlement areas. And actually, when most of the single points of failure analysis that we were doing, when we were getting the focal groups to identify what their single points of failure were in their own districts and what would be their priority lists to deal with that, which could then feed up to the mayor to be able to identify where scarce resources can have best effect to reduce that, to reduce some of those resolvable single points of failure. And of course, the fundamental point, it was actually at the very, very limited level of we need shovels. We need very, very simple items. And the idea of early warning systems, it wasn't necessarily that they weren't valued. It's just that it was so distant in their away from their indigenous knowledge that that's their early warning systems. They knew where it flooded, that the technological solutions, if they were to come and be consistent, were so far removed from the realities of what they were discussing. And that's partly because, of course, in the early warning dynamic, it's very much related, at least perceived to be in related to risk reduction and preparedness rather than necessary response. And the volunteer network is effectively quite strongly identified with response. I would say, however, that there is a significant movement because there's been the establishment of a national organisation of community disaster management committees bringing together. And they're bringing together because of the weaknesses at the subnational and national level in supporting them, providing more self-reliance, if you like. But it's actually where the risk reduction element is starting now to feed in and where that cost dynamic can actually be inserted of value. And I think that's probably the where we are in the picture that we have in this particular country in Africa, if that's helpful to you. Yes, madam.
Sorry, it's okay.
Can I? Okay, so can I take this one because one second, you can come in back.
Yes.
I do apologise.
Hi, I'm Helen Cahay from the Met Office. It was something around what you said, and I'm sorry, I don't know whether it was health specifically, but the West African early warning system, and then also having this local early warning system. One, people not being aware of it, and I wondered, we've been talking a lot about the trust element being important in terms of where people receive information from, but whether that has something within it. But is there anything that has been learnt from the Sierra Leone experience of the early warning systems that can actually be fed back into the wider regional approach then to early warnings to help improve kind of, collaboration, or that, some of these are transboundary issues and so on? So it was just a comment or a reflection on anything that can be learnt to help maybe reinforce systems that aren't working as well.
I'll take part of the reflection of that, maybe Martin or Joy, if you'd like to come in. One of the reflections, often those weather reports are coming through WhatsApp. You have effectively most of your response is actually, in terms of community, done through WhatsApp because of the nature of low tech, free, all of those encrypted, all of those kind of aspects to it. Well, one of the immediate challenges, there's a World Bank project at the moment as part of what's called the Russell P facility, trying to do something with this, involving the Met Office. But this is effectively the consistent challenge about accessible information. A lot of the stuff coming from Met officers, from SL Met, was basically say, well, there's going to be sort of sprinkle showers tomorrow and a lot of heavy rainfall. And for a tribal leader in Susan's Bay, what are they supposed to do with that? That has no meaning to them. So in that sense, part of the challenge is, of course, that transmission and training, which parties in this room do a lot in parts of the world, but also the consistency of it. Because your volunteer networks have some durability to them, but they're not always consistent all of the time. And actually volunteer issues across the sector, across disaster management, and particularly in the developed world, are a challenge in terms of numbers, commitments, whether they should be paid, all of those kind of questions that come into it. So there is a real challenge about, even if you can get the information to, it's very low tech, bite-sized, and has to be in the right kind of way. And it's at that level where it ain't going to have the maximum effect. So actually training people in the Met offices to provide that kind of accessible information, which alongside the stuff that Martin was talking about what will happen and where the rainfalls will be and the high tides, provide meaning for parts of the city.
Well, to answer your question, yes, there's lots of lessons to be learned, and the challenge we had was building a network to make sure the information was being passed. So as I left in March 2022, there's a really good early warning action group that's been convened, which had all the local and national interested parties, so the National Disaster Management Agency, the Met Office, the Department of Science and Technology, the local council, they're all there. But there was no regional participation. So I think that is something that needs to be, as you rightly point out, developed further.
Yeah, and
Do you have a comment at all?
yes, please. And again, about the West African Early Warning System Coordination Office, it's actually supposed to be a coordination office. So recently, we had rumors about a chemical spillage over on one of the neighbors' side, the Guinea waters. And it was so difficult for us to get that information. At the end of the day, we had to get the information from WHO. So in terms of the health platform, there's a lot of coordination, intercoordination, regional coordination among the ECOWAS or the West African countries through the WHO. That's one lesson that can be learned. But through the early warning system, and it's supposed to be the West African early warning system, there's not much coordination. And we also have a problem with the language barrier because Guinea speaks French and Sierra Leone and Liberia, and we speak English. So that was a challenge, and getting that data of the chemical spillage was a problem. We had to finally go get it through the WHO. So a lot of data we can get through the WHO, like you said, thinking about trust, and rather than the West African Early Warning System Coordination Office.
Thank you, Joy. Madam,
Exactly. I'm sorry, I'm Biash. I'm doing my doctoral research right now on vulnerability assessment. So my question was for Martin. How do you propose that we scale up our hazard mapping, because obviously it's a really time-consuming process. So how do you think that we can actually scale up and do it in a more broad range?
Yeah,
way?
well, as I left Freetown, that conversation was the live conversation of the moment. But as you saw, we were just using a map of Freetown with basic ward boundaries. And what was lacking was the GIS data at that level. I know that the Met Office were working on it with some support from various international agencies and organisations. But that hadn't yet percolated down to the district. So I think in terms of scaling up what I showed you, that is all about using GIS technology to connect the dots sort of nationally and locally, so that your baseline becomes a lot more dynamic and it's based on much more high-grade information. So I think scale up the basic stuff we're using with the technology is my simple answer.
Another question, it's just about the methodology. Do you also use some kind of socioeconomic data, or is it just GIS and meteorological data?
So what sort of data?
Socioeconomic data.
Yes,
for-
we do. Yeah.
Okay.
So there was a organisation in Freetown who had spent 5 years in every ward in the city looking at the social and economic characteristics in Freetown to work out where the priorities were for various groups who required what type of support in what locations. So yes, if I can remember the name of the organisation, I'll try and give it to you before I leave.
Thank you. That would be great. Thanks.
And yes, and also there's a tool developed by WHO for risk assessment. It's called the Strategic Risk Assessment Tool. It's STAR, STAR. You can also use that. It's quite comprehensive and easier to use than the previous one that they were using, which is VRAM. So STAR also can help. It has all the socioeconomic, it provides you, it gives you the platform to provide socioeconomic data, GIS data and all. It's called the STAR tool. You might want to check that out as well.
Thank you, Joy. We've got time for one question before I move over to the online one. Is there any questions at all? Yes, sir.
Hi, I'm Robert Powell from Resurgence. I'm a specialist in communicating emergency information over the last mile to vulnerable communities. One of the things I've found in many contexts in Africa and the Caribbean with weather information is that people just don't understand the language that meteorologists speak, and the meteorologists won't change their language. The journalists with degrees, they don't understand it, let alone the community leaders in the slums. So why don't you get those people to co-design the early warning messaging systems? I mean, Martin, you put up an infographic showing weather forecast over 5 days with lots of different numbers, which means something if you're trained in interpreting weather information. But a 25-knot wind, a 40-knot wind, a 10-knot wind, or kilometers per hour, or meters per second, people just don't get that. But what I've found is that if you color code things by how serious is this, if you have a tree that bends over more and more, the stronger the wind is, then people can understand at a glance. And you'll find it's not just your low-income people, your low-education people, even the people at the top, if it's visually presented in the kind of visual language that they can understand, they will understand it much better. They will see the value and take ownership of it and act upon it. Has this been thought about in the Sierra Leone context, actually getting the vulnerable communities to co-design the information that goes to them?
Sure, Joy might have an answer, but I'll give you my perspective. Yeah, I think I agree 100% with everything you say. And what we're doing in the council was taking that weather report that I showed you and breaking it down so that councillors acted on the high wind, the high tide, the storm surge. So we were literally interpreting, we're by no means experts, the weather reports and trying to tell the councillors what was happening in their area. Concurrently, I know that there was a project in Freetown. I think it's been run by an organisation called Codisapa, and they were using infographics at a community level to try and convey the meaning of these weather reports. Now, whether or not that's happening at a national level, I cannot recall, but I hope it is. Joy, do you have anything?
No, it's yeah, thank you for giving that comment. And that's really true. Most of the time the community do not understand really the data that is coming in. And what meteorological department does to the telecommunication services is just a written report, like there's going to be flooding at this time in the community that is supposed to happen. So that data is disseminated. But like I said, we have network connectivity issues, and for the non-educated people, they can't really read, even though you put it for people to read simply. So, but for health, it's a lot of job aids that we use. So the community health workers are really not like technical people, but we use job aids to get down to the community. So once you do an illustration of how Ebola signs are, people can easily watch that and comprehend. Everybody knows about it. COVID-19, once you do a mask and stuff like that, people can easily comprehend. So on the health side, we're using more of job aids than these technical terms in terms of early warning systems.
Just to respond finally on that point, I mean, your point about using visual graphics and infographics is really important, but also, of course, it has to be, as you quite rightly say, jointly designed by the local communities, because different images are interpreted in different ways by different communities, and even within a city. So in a sense, there was a lot of symbolism attached to different types of images, which we can't always leave to the meteorologists, for example, to design, which might lead to a lot of tension across that city. And we also know that from in the Sierra Leone case, from the experience with Ebola, where a lot of the Western approaches early on in that were simply, let's say, culturally inept. And led to a lot of problems with particular communities on the ground. So there is some caution about using those, or if they're going to be used, they've got to be used in the right way because of the experience of the past. I'm just going to hand over to Nick now for any questions online in our last 7 minutes. Over to you, Nick.
So we've got an online question from Linda Farelli of Risk Alert. The question is, what are the rates of mobile penetration in Sierra Leone, text-based and smartphone individually?
Martin, do you want to take that one from in Freetown?
I haven't got the exact figure, but the general gist of it is that most people in Freetown have a mobile phone, but not a smartphone. So SMS text messaging works pretty well. WhatsApp less so. Joy, do you think that's correct?
Yes, that's correct. The only problem, there's a myth that when it rains or when it starts thundering or lightning, it affects you. Like if you keep your phone closed, it's going to cause some fires or so. So a lot of people just put off their phone once it's bad weather. So even if you're sending an information, I mean, they can't get it. But text messages, yes, you can communicate to anyone, can get a text message at any place in Sierra Leone.
I think the question, not just mobile penetration, it's also what you might say is internet coverage, which is a real challenge outside some of the metropolitan areas. 5G at all in the country at all, very little 4G, if I'm correct also. So, and of course, so therefore your bandwidths and dead spots and hotspots are real challenges in this particular space. And it's by no means coincidental that those areas that often suffer from vulnerability are those where the mobile coverage is also weakest. So from that perspective, there's a number of aspects there. Anyway, okay.
Last one.
Yes.
You mentioned as one of the challenges with actually actioning early warning systems as paternalism. Can you explore that just a little bit, please?
Paternalism?
Yeah.
There is a dynamic in some of the West African countries I worked in, where when people are in power, they feel that they should be using all methods possible to benefit those people in their families. Now, some people in the West might call that corruption. Some people might call it paternalism, but paternalism, that is what I mean by that dynamic. So, for example, a politician comes into power and feels that he or she is doing exactly the right thing by benefiting his or her community over others.
What are ways to combat that?
It's politics and it is democracy. So if you have a system where people can vote fairly, correctly, regularly, for people that want to be in power, then eventually you'll overcome that. So it's down to democracy. That's a very complicated question, and I'm not the right person to answer it. But
Maybe Joy is.
so maybe Joy can help you.
Joy, we've got to ask the Sierra Leone in the question on that one.
I know. So, he's right. Sometimes that's what happens. People in power, like, come and they feel what they're doing is just the right thing that they're doing to reflect their communities, but actually they're benefiting their family members, and it's more like corruption, but like in their interest, like most of the things they do take it to their communities, like so that the next time you're voting, you're gonna vote them. This person did this person brought this to our community and stuff, and it's just chaotic, and sometimes all of the times it's not a nice approach at all. But like Martin is afraid where we don't usually shed lights on it, or if you're in the dynamics then you'll understand more. But it's just like corruption.
I think the challenge, it's a bit more general question for disaster management in its entirety or humanitarian intervention. Striking that balance between the principles of humanitarian intervention and independence and neutrality and all the things that are used across the international sector and for operational purposes, and the ability to operate in a cultural setting which is sympathetic to the culture. Because in the sense that there is a trade-off that has to be made within that. And many people don't like talking about it officially, but in practice, my assumption is that that's the case, because it's about respecting the indigenous cultures, because in some instances, this is just the way the culture operates. It's not necessarily an issue of right or wrong, it's the way the culture operates, there's a cultural acceptance. But that brings me to the answer to your question, which is one of the challenges is when that cultural acceptance breaks down between parties, the consensus breakdowns as to the level that's acceptable before it's seen as being overwhelmingly favouring one group or another. So in the Sierra Leone case at the moment, there is a real challenge. Of course, it's had a history of civil war and a very nasty one at that, and the success has been having 4 changes of power, 4 elections where actually that was done with reasonable, peaceable transition. And in West Africa, we don't necessarily have that. But the main challenge at the moment is, of course, you have non-cooperation between the political parties, which are in many instances tribally orientated or have non-tribal bases, but which that paternalism question and or corruption question is never too far below the surface. What many people might call the negative peace argument that operates in there. So we're in a kind of dangerous space, I think, in Sierra Leone, which I think is what Rod is alluding to, as to whether that cultural acceptance is starting to break down. And that's when we have to worry, because many of these issues to do with early warning systems are not then about natural disasters. They're about open conflict and ethnic strife. And that's what is a concern in many of some grounds in Sierra Leone.
All right, so I've divided my graphic recording in these 3 different parts. So the first 2 talks, and then the talk which was remote, and I'm just going to zoom in on some of the points. So the first talk by Professor Lee Miles talked about the single point of failure to learn from these the different aspects. Also, I've put down the different categories with the resolvable, obviously spelling error, but I'll fix that later, residual and resistant, and then the importance of creating a narrative and this have these actionable items for early warning systems, which might not be seen as important yet. Then in the middle, there's the second talk by Martin Travers with the technology which is available, but there's a very manual analysis. There's a lot of capacity building, network on many levels, but also the talk on resilient communities and to have clear action plans done. So to see when there's a flood coming, then who is at risk, and then which plan can we follow. And then the last one with the talk by Isato Joy Karu Sesai, getting together on a local level, but also knowing that each ward has very different risks, and then the importance of coordinating the information and action, and also, which is something that I'm very drawn to, also to include visuals, to translate the data and to include the locals in translating the information.
Fantastic. That's good, sir. So thank you all for the session. And we'll call the session to a close. Thank you, Joy, for joining us. I can't see you there, but thank you very much for joining us there. And
You're welcome. Thank you for having us.
thank you.